Hello, buddy. Sanir, engineer, MBA, and investor. And in today's video, I want to talk about NTLA latest partnership with a company that's tackling CAR T cells. I want to talk about all of that in this channel, in this video. Now, before we jump into today's video, before we do that, you guys know the drill. Like this video, smash that like button, destroy that like button, guys. Really does help the channel. If you're not subscribed, then please consider subscribing. It's quick, it's free, it's easy. Just hit that notification bell as well underneath this channel to go a step further. And if you want to go even a step further than that, you can join the channel by clicking join. It's again up to you. Thank you so much for the support, guys. Just a couple of notes before we jump into today's video. I am still in Pakistan right now. It is a beautiful country, having a great time. Beautiful people, nice people. Everything is really fun. I know some of you viewers have been asking me how I'm doing. Doing 100%. Still will be here for the next week or so. Lots of things to talk about, lots of things to discover. It's just an amazing time for me and for my family to learn and then use that experience to move forward in our careers and in our lives. So thank you so much for the support, guys. Again, I know some of you are curious, so that's why I'm saying this right now in this video. But let's jump in today's video here. NTLA and Kyverna Therapeutics announced collaboration to develop a next generation allogeneic T cell therapy for autoimmune diseases. Now, I don't know if it's Kyverna or Kyverna. At this point, I never know how to pronounce these Y's sometimes, but I'll just say Kyverna for now. But basically, NTLA, they granted Kyverna exclusive rights to differentiated allogeneic cell engineering platform for development of KYV201, a next generation CD19 CAR T cell therapy to treat autoimmune diseases. Kyverna to lead and fund preclinical and clinical development, NTLA to receive option to co-develop and co-promote with the lead US commercialized rights. So a couple of points there. First of all, amazing news for NTLA, right? NTLA, obviously, with what happened last summer with their data with in vivo, it just revolutionized their company to sort of become the number one market cap size valuation in the CRISPR space. Obviously, validated their company in terms of technology, but also about their leadership, right? It's one thing to talk about it, but it's another thing to execute on it. Obviously, we've seen what they did with base editors. That's still in progress. We still don't have much details. We can't say for sure that's going to come to fruition, but so far they're going forward with it. They have not backtracked. And we've always said that NTLA has the leadership and technology to sort of develop these types of partnerships, right? And this is what we talk about. This is what I'm talking about when I'm saying partnerships. I'm talking about these types of private companies that's approaching NTLA is like, guys, we want your technology. We know you have the leadership. We want to have a fair agreement. Can we use the technology? Can we license it? And then basically we can give you the option to commercialize it in the future. Similar to what Beam Therapeutics has done with Sana Biotechnology, what they've done with Verve Therapeutics, and so on, right? So I love this type of partnership. Again, I love companies that build a platform, right? A partnership. This is what you need in genomics. This is definitely what CRISPR companies have to shift towards. It's one thing to have an amazing program like CTX001 to go forward. You definitely want that to be FDA approved. You definitely want to validate your technology by doing that. But there's all the other ways to sort of generate revenues, and I think this is what investors, especially investors coming from the tech space, coming from those legacy valuation ways of things, non-biotech investors are looking at, right? So I love that. So basically, this news came about on the 5th January, basically yesterday or 2 days ago rather, and they basically announced that collaboration, licensing, and agreement for core development of CD19 T cell therapy. There are other companies tackling this space, right? CAR T, whether that's Caribou Biosciences, whether that is CRISPR Therapeutics, Beam Therapeutics, and so on. But what is amazing here is this is ex vivo, right? So we know NTLA to be the in vivo company, right? With Cas9 first generation rather. But the fact that they were able to grant Kyverna rights to use their proprietary ex vivo CRISPR-Cas9 is a testament of how when you succeed in one branch, you can sort of validate yourself to be that type of technology company that can leverage other tools like ex vivo Cas9 or even base editors, right? And I love that. I don't know if you guys catch that, but I just love that type of approach here. Kyverna obviously is a company. I did some some research on them briefly. We'll take a look at their website briefly here, but just to finish here, Intellia will eligible to receive certain development and commercial milestone payment, as well as low to single to mid digit royalties on potential future sales. That's the type of partnerships you want. Now, Kiverna is a private company. It is still a small company in relative size, but that doesn't change it, right? You can see these types of numbers. Look at this. It will opt in a fee and share 50% of development costs and future sales revenues. Again, these numbers are subject to change and so on, but I just love these types of the partnerships. I just love it. That's what I want to see from CRISPR companies, especially in this bear market. I mean, your technology, FDA has its own limitation with delays and costs. We saw what Bill Cure 2.0 is set to bring to us: less delays, less cost, right? It's just going to be better efficiencies and so on. But until then, what you can do is sort of develop yourself to be a platform, right? So that's exactly what NTLA is doing here. Let's take a look at some of the news here. NTLA bags an option autoimmune CAR T prospect handling Carvana rights to use CRISPR tech to create off-the-shelf cell therapy. So basically, what we talked about basically goes over the news here. You're having a really general um, general positivity to it. Look at this, guys. It's return to use its platform, right? The keyword is platform. You want to see that, right? So I love it. I love what I'm seeing here. Um, and I think the CEO of CRISPR company, NTLA, John Leonard, has been an amazing leadership. This is the type of leadership you're looking for when you're investing in companies. You want a company that's able to not just talk about technology, but also about business, about partnerships, about commercialization, right? That's what CRISPR Therapeutics have been doing, and unfortunately, they've sort of been under the radar because of the whole bear market. But these partnerships, valuing your technology, you don't want to be a one-hit wonder. You don't want to be a one-trick pony. You want to be a ace of all spades, right? And this is exactly what NTLA is doing here. So I love what I'm seeing here. This deal comes around 6 months after NTLA teamed up with Blackstone and Selects to form Avencell, a startup using CRISPR-Cas9 genomic technology to create off-the-shelf CAR T treatments. These two deals are underpinned by similar thinking. So this will be compounded. I love it. So just the last point here, Kiverna's website, you guys can all access that. It's all public. They're going over, they seem to have like an approach with CAR T cells that I think is sort of maybe unique, maybe not. I haven't really done too much research into that, but it looks like they're really tackling the CAR T. Obviously, CAR T is all about cancer cells, right? You always want to, this is something I think a lot of us are not used to, the CAR T space. I think a lot of us used to like edit a specific gene to prevent like a disease like sickle cell disease or beta thalassemia. But CAR T cells, guys, this is a huge TAM. There's so many cancerous patients with different levels of severity, and then you need those CAR T cells to basically be injected in those patients, just like what you're seeing here, right? You have donor T cells, you basically modify them to have a certain new genes inside them, so that you genetically engineer them in a sense where they can last, they can have durability and actually complete response on the patient's body. This is exactly what we're seeing here, therapeutics, T cell dosing. And what I find here interesting is that this company has like three different technologies here: CAR T, SynReg G, and then Sinotech CAR T. I won't go over this. This is way off my field of expertise here, but I love how they're really specific with CAR T. These are the type of companies that are like, guys, we want to tackle the CAR T space because we think we can do something here. They're not trying to fire from all cylinders. They're really focused on that. And I guess what they saw here is an opportunity to use the ex vivo approach, but by partnering with a company like NTLA. Now, could they have partnered with CRISPR Therapeutics? Yes. Could they have partnered with Beam Therapeutics? Yes. But they chose NTLA, right? And to me, there's many factors involved, but just don't forget, guys, it's always about having the leadership to make it happen, right? Getting the job done, and that's what NTLA did. Let me know in the comments below what you guys think about this news. I love it. This is great news for me. It's great news for, I know, many of you guys and as investors. If that's what you want to see as a company, I'll leave you guys off with this. Do like this video, smash the like button, destroy the like button. Let me know what you guys think in the comments below, right, about this partnership. And let me know what you guys think about this company. Thank you so much for watching and have a beautiful, beautiful day. Thank you.